Thank you, Dr. Rob.
You're welcome. So just to say, Tammy's really wonderful and in recovery a very long time, and she and I do a question and answer on Monday nights on our own site, which is sexandrelationshiphealing.com. And I mentioned that because we have a heck of a lot of fun talking about some very difficult topics. And we're really in good with the in the rooms people. So we often talk about our stuff with them and they talk about their stuff with us. So they really support this kind of work because they understand that you need a place to go to talk about intimacy and relationships. There we are. But this topic, so let me just tell you a little bit. I've been in recovery for 35 years. I entered the program in the early 80s when this whole idea of codependency was just coming about. And at that time, I had a really troubled family member who was very ill with addiction and mental illness, and I was responsible for this person. And so I was often going to support group meetings for people who love an addict, for people who love a troubled person, because I needed support. Just like addicts need support from each other, I needed support as a caregiver. And what I found in caregiver support at that time was this word codependency. And what essentially it told me was that there was something wrong with me for being willing to give up part of my life to help someone else. That a healthy person would not be so dependent that they would feel they have to give up something of themselves to help others, that independent people let people help themselves. And so there was this whole message I ran into as a caregiver, which was kind of like, you got to let the person struggle, let them be on their own and struggle. You got to take care of your own life. When they want help, they'll come to you. You know, just all of this stuff. And I was further told that it had something to do with something that was wrong with me, that I'd chosen to be in a relationship with this person because I was in a relationship with an addict. So I must have chosen an addict for a reason, and that must make me codependent. What? None of it made any sense to me then. A whole lot of it doesn't make sense to me now. But I did do this, guys, just for you and me. I don't just talk. I did my PhD dissertation on the topic of codependency. I read every book, every article, everything in different languages. I know the topic. And I was right. It doesn't really exist. It's a made-up thing that a lot of people believe in that doesn't really exist. So I'm going to do two things. I'm going to talk a lot about codependency and some of the problems with it. And then I'm going to talk about a different way that we might look at helping partners, which I think is much more loving. And I have to talk about this really fast because this is a 90-minute talk in less than an hour. So let's get started. Here we go. First of all, the book is called Prodependence. It was out 1.5 years ago. It's been tremendously popular. People are starting Prodependence meetings all over the world. Very exciting for me. But I have to explain it to you first. So let me start with a medical model. So this is a story that I'm making up. It's not true, but I'm going to play the part and tell you what's going on in my life. So let's say I'm a married guy and I have a wife of 15 years who has been diagnosed with cancer. And my wife is resistant to treatment. She doesn't want to go through chemo. She doesn't want to lose a breast. She's really struggling. She wants to do some alternative, something or other. Now, we have 3 kids under the age of 14 at home. And I don't know what's going to happen to her, whether she's going to live or die. So during the time when she's really ill and at home, I go out of my way to assist her. I still try to care for my family. I push away all my own needs and desires. There's no time. I start working 2 jobs. I stop taking care of myself, put all my focus on this other person in my family. I'm not really having much fun. I'm not doing recreational activities. I'm gaining weight. I stop exercise. I'm losing sleep. I'm worried all the time. I feel sick. I feel fearful. I'm very vigilant and I'm afraid. In this scenario, with me having a beloved partner who has cancer, and I've taken all my time and energy and focus away from my own life to help them, how do you think friends and family members and a therapist would react to this situation? How would they advise and support me? Do you think they would consider me and my family to have been, in a sense, victimized by cancer because we never saw this coming and we didn't really know it was an issue, and then all of a sudden it happened? And I think you guys already know the words that would be used for me, because in our current recovery codependency world, for having given up so much of myself to this other person. But in any case, in a medical scenario, this seems to be very appropriate. And I think many of you, if you were to come to my house when I had this spouse with cancer, you might bring me casseroles or cookies or something to help me. Or maybe you would let me have the night off and watch my wife while I went out and had some fun, because you see me as a hero in a very difficult set of circumstances. I love her and she's failing. and I'm left having to care for my family. Now let's do this whole scenario over, exact same thing, only now I'm going to talk, and that's the next page, I'm going to talk about it from a different perspective. So my wife of 15 years is addicted to opioids, Vicodin, Oxy, whatever she can get her hands on. She's facing a third round of rehab, and she's very resistant to going back to treatment. She says stuff like, well, maybe with someone like me in my pain, I just need to be on drugs forever. And there must be other, she's not really ready. Now, we have 3 kids at home under the age of 14. The outcome of her sobriety is completely uncertain. And in response to this crisis, and this may sound familiar, I go out of my way to assist her and care for my family. I push aside my own needs and desires in the process. I start working 2 jobs. I stop self-care and recreation. I start to gain weight. I stop exercising. I lose sleep, and I think about them all the time. I feel sick. I feel overwhelmed. I'm vigilant, and I am afraid a lot. In this scenario, with my opiate addict sitting in bed upstairs watching TV, as opposed to my wife with cancer sitting upstairs eating in bed and watching TV, how would my friends and my family members, my therapist and my employer react to this situation? How would they advise and support me with this spouse? Would they consider me and my family to have in essence been victims of drug and alcohol addiction because I didn't see it coming. We got married, and I didn't know she was going to end up on medication in the hospital, nor did I ever think that she would end up using it for 2 years. So were we victimized by it? So I'm going to suggest to you that the way that many people would handle the first scenario in relationship to me and the things they would say about me, helping that troubled, sick partner with cancer, is very different than the things that people would say to me because I'm trying to help a troubled, sick person with an addiction. And I think the things that would be said to me with a physical illness would be really sweet. And I think the things here would be more cutting. Like, why are you giving so much? Why are you doing so much? Blah, blah, blah. I think is what we would hear here. And my thought is, well, what's the difference? And you already know the difference. The difference is that anything that involves addiction is going to get stigmatized. So if you are a caretaker of an addict, you're of course going to get stigmatized along with the addiction, whereas the person caring for someone with cancer doesn't have that, oh, you're hanging out there with a troubled person part. Now, people who are caregivers in other kinds of health are stigmatized too, but not so much in the physical health world where we see them as being appreciated. Don't forget that female gender roles, nurse, caregiver, mom, we've always devalued those roles, social worker. We have a documented history in the addiction field of blaming hurting, angry, fearful, beloved spouses and calling them names. Now, in mental health, they no longer embrace a codependency model. If you go on mental health sites now, there's nothing about detachment, step away, work on yourself. There's nothing about that model that is there now. What's there now is about how do you stay connected to the other troubled person while taking care of them and yourself. I think the mental health community learned the lesson of codependency not working, which is if you have a mentally ill, troubled person, and you say to them, oh, you got to do it on your own. You're going to pull yourself out of the bootstraps, and I'm not going to rescue you or to turn into a victim by your problems, and I'll just stay separate from you. That's how you get homeless people. That's how you get people who should be taking care of their family members because they're mentally ill saying, woo, I got this codependency message. They need to take care of themselves, and I need to take care of me. Great, they're not my responsibility. So the mental health community gave up on codependency a long time ago because it removed the responsibility of the caregiver for the person with the problem and really told the caregiver that they had a problem just for caregiving. So now our shaming of female caregivers is nothing new. I did some research on the history of the addiction field, and we actually have a guy who's a historian in the addiction field. His name is William White. If you want to learn more about the 40s and 50s and 60s and the old days in AA, look up William White. But this is what Dr. White said about how we viewed spouses and family members and partners of addicts in the 1950s and 40s. He said the general view of an alcoholic wife depicted in early AA and psychotherapy literature was that of a woman who was neurotic, sexually repressed, dependent, man-hating, domineering, mothering, guilty, masochistic, and or hostile, and nagging. That's a little harsh, don't you think? And then it was further followed by him saying the typical therapist's view of the wife of an alcoholic in the 50s and 40s was generally one of, I would drink too if I was married to her. So we have a history, a documented history in the addiction field of devaluing, loving, caring spouses who are trying to get us better and who are hanging in there. And then in addition to that, we have a cultural history of devaluing people who are caregivers. And we have this codependency thing, which came in on top, that started to devalue and dismiss what caregivers give to troubled addicts. I think all of this is a problem. Over the past, over the past 35 years, and I've been in this field since the 80s, we have seen multiple new treatment methods come up for addicts. You know, we have smart recovery and Buddhist recovery, and we have body work and yoga work and meditation. We have a million things that we have applied formally to the process of addiction recovery. But when it comes to formal research-based new models for the treatment of family members and loving spouses and parents, we have nothing since 1986, when Melody Beatty wrote Codependent No More. Now, the codependency model, 35, almost 40 years old, when you evolve it, when you restructure it, when you stretch it and advance it to meet how we look at addiction today, rather than how we looked at addiction in 1986, it's still codependency. You can't make it anything else. It is what it is. It's a trauma-based view of partners that says these people are going to act out their own problems in the relationship with the addict, blah, 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 blah. So we really don't have any new fully articulated or researched models to support, love on, and help partners, spouses, wives, husbands, and the people who love addicts, not in a very long time. By the way, not a big surprise that the addicts get all the attention, but nonetheless, where addicts get our grounding and our foundation is with healthy family and healthy community. And here we are telling our healthy family and community that they love us too much, they take care of us too much, and they're too focused on us. Well, that's not really helpful. Now, I'm not going to go through the whole history or any of my research. I'm simply going to tell you this. Wait, before I get to that, I do want to see something else. Hold on, don't go away. So I want to tell you there's many things that the idea of codependency came out of in the 1980s. But the primary reason we have codependency and why it became such a huge cultural icon, everybody read the books, everybody, like in the 80s, you know, you're a co, I'm a co, everybody's a co, let's go to the mall. You know, it was kind of like that. And so this idea of you're a co, everybody's a co, if you're giving too much, or if you're loving too much, if you're not focusing enough on you, you're a co, that became a huge pop culture phenomenon. However, I'm not sure that it really mirrors or matches up with the problems that appear in loving relationships when someone is an addict. I think the problems are different than the way they've been described. And And I think in great part what brought about codependency was the women's movement. The women's movement in the late 1970s and early 1980s looked like this. And I researched all this stuff, you know. So the Equal Rights Amendment had just failed. I think it was 1979. And women had to go back into the workplace and were flooding into the workplace, but they were not equal to men. They had no equal rights to men, but they felt like they deserved them. So in the 1980s, women were banging on the glass ceiling, and the last thing any woman wanted who was out there trying to work and get ahead in the 1980s was to be a dependent on some man. The last thing a woman wanted was to look up to a man, expect him to validate her, look to him for attention. She wanted to be independent. She wanted to make it happen for herself. Men had been the problem all along. And out of that came this idea of that dependency, especially on men for women, is a problem, and that women need to stand up and be more independent and be less dependent, more like men are, and not be so needy. Well, women are women and men are men, and we have the characteristics we have. And it seems like at that time, in some ways, feminism was devaluing some very beautiful natural characteristics that women have, like empathy, compassion, and relationship building. And it was kind of like saying, well, that doesn't work for us. Go out there and be like more like men, be competitive and aggressive, and don't work too hard to make someone like you or need you. Well, it was a really helpful message for women who were trying to figure out how to break through the glass ceiling. And you can see this codependency message in action if you look at a movie called 9 to 5, which is out in the 1980s. 9 to 5 was a movie with Lily Tomlin and Dolly Parton and Jane Fonda, and it was about three women who were just plain nice women, and they were pretty smart, and they were coming to the workplace, and their stupid ass male boss didn't want to listen to them. And they did all kinds of stuff to get through and past and around this stupid ass male boss because they knew that he wasn't going to listen to them, and they knew they were smarter than him. So if you look at 9 to 5, you see the struggle that women had at that time, trying to be heard independently, and how much they did not want to emphasize their dependency on men. And that was absolutely the right message for women in the 1980s and 90s, to individuate, to step away from men, and that to lean in too much, to be too much of a caregiver, to be too responsible for that man was meaning that you weren't fully actualized yourself and you were wasting your time on someone else. And further, what was wrong with you in your past that you were wasting so much time on someone else and not focusing on you? All this is codependency thought. Let's talk about how it came about. These are the big four books that defined codependency in the 1980s. I remember them. I am that old. They defined and dominated the field and the concept of codependence throughout the 80s and then there were more in the 90s. They laid out the underlying concepts of codependency in this model, which remain unchanged since they were published. Because you can't go back and say, well, I see codependency differently, even though that book that was written to define it looks like this. If you want a new model, you have to make a new model. You can't call it codependency. Codependency is what it is. And it really was defined in these four books in the 1980s. Claudia Black's It Will Never Happen to Me, Robin Norwood's Women Who Love Too Much, Melody Beattie's Codependent No More, and Tim Cermak's Diagnosing and Treating Codependence. And Dr. Cermak's book was particularly important, the one on the right, because he was trying to get codependency in the DSM into our mental health encyclopedia, if you will. He wanted a written, criteria-based diagnosis for codependency with a number so that you can bill insurance for it and it's a real thing. And that never happened. And this is part of what I want you to understand. Codependency has never, ever been a diagnosis in any of our clinical manuals, not the DSM, not, if you know my world, the ICD. No clinical manual, no research has ever validated this pop culture concept that we call codependency. And yet, there's only one place in the mental health or recovery or healing world where you constantly still hear about this concept, and it's in the addiction world. Partners and loving family members and wives are still considered codependent, nagging, complaining, whining, and all those horrible things we say to them. And then addicts now have a new excuse since codependency for continuing to use, because we can say, oh, well, if my spouse just wasn't so nagging and blah, 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 I wouldn't be using. The whole concept didn't work, and in fact is working backwards. Over 11 million people bought Codependent No More. It was sold into 16 languages. Women bought 95% of these self-help books, as, by the way, women buy 95% of all self-help books. I know this because I sell self-help books. And so guess who was reading Codependent No More? And guess who was identifying with this issue of, if I am too dependent, then I'm unable to get ahead and be myself? It was not men. Men in the 1980s were watching Top Gun. We already knew where we were on the hierarchy. We were not worried about being overly dependent. That wasn't a man's problem. That was a woman's problem. But getting back to codependency, it was popular. In 1990, there were 102 books with some form of the word codependency, only 4 years after Melody Beattie wrote the book. But then as of 2018, 2 years ago, there were 340 books with some form of the word codependency in the title. And yet, neither codependence nor codependency has ever been in any of our diagnostic manuals. There's never been a criteria-based diagnosis. It has never been clinically validated. It has never gone beyond the concept of a pop culture notion. We have always had in my field, mental health, a diagnosis for people who are so dependent on others that they're not able to function. There really wasn't a reason to add another diagnosis, codependency, for people who were involved with troubled people and they tended to lean. It just never happened. It was never a diagnosis. It was always a concept. Now, looking back just a year or two, I found that there are 1, 2, 3, 4, 5. There are books number 338, 339, 340, 341, and 42 with titles like Codependency Loves Me Not, Codependency for Dummies, The End of Codependency, Conquering Codependency, and Codependency Guide. We are still doing this. We are still writing hundreds of books on a topic that we've never really defined, that is 35 years old, and that does not really mirror how we look at mental health today. And the only reason that I conclude that people are still writing books about it is because they haven't figured out how to work it, because it doesn't work. When something works and you figure it out, you don't keep writing books about it. I don't think this works because the whole concept of codependency speaks to people being overly dependent. And I'm not sure that's such a bad thing. Because you know what? If I'm struggling, listen, if there weren't overly dependent people on this earth, how many of you addicts would have been completely alone in your addiction? Where would we be if there weren't loving, kind, nurturing people who put up with our shit and stuck by with us and helped us anyway? Do we need to then turn around and give them a bad label? How about turning around to those people and saying, thank God that you supported me. Thank God that I had somebody who still believed in me when I didn't even believe in myself. That's a wife, a husband, a parent. And then they get us into treatment and they finally feel relieved, like, oh my goodness, I've done a good job. I've gotten this person I love into help. And they come into one of our programs and we turn to them and we say, well, let us tell you, thank goodness for helping that person. You were great. Of course, you didn't do it perfectly. We'll get to that. But let's talk to you about your codependency and why you spent the last 2 years focused on them and how you've given up your life for them and about what's wrong with you, which initiated in your childhood. And that makes partners and family members go crazy because in their mind, they've done everything they possibly could to try to get this person sober and make their life go better. And then when they finally have maybe even done that, we turn around and talk about what's wrong with them. And some of them take it, which I think is even worse. You know, the book Codependent No More and a number of those books were written by women who had alcoholic fathers. They say so in their books. And then all 4 of the women who are the progenitors of codependency went on from their alcoholic fathers to marry abusive husbands. That is where codependency comes from. It comes from the experience of 4 women who said, this was my experience and that's how it ended up. And it must be like that for everyone. But it isn't. Not only is it not true for everyone, but there are some people who are natural caregivers, who love taking care of other people, who, you know, I had a friend in high school who was really, really smart, super smart. And I thought, this is a woman who's going to really go places. She could be, you know, PhD, all that stuff. I saw her brain. It was big. And I was shocked when in her 30s, she decided not to work at all, but to grow her family and take care of her kids. And I was like, you have such a huge brain. I was in that coda place. Like, why in the world would you focus on your family when you can get a nanny, you can get help, and you can go out there and use that huge brain to help people? What's wrong with you for wanting to stay home and take care of your family when you could be out there on your own succeeding? That's codependency stuff. That woman has wonderful kids. She has a great family. She has produced, and the energy she put into that created a unit that is so powerful. I can't wait to spend the holidays there. I feel so connected because they're all such good people. And that had a lot to do with mom deciding that her career was going to be caregiving. Now, in the middle of feminism in the 70s, people would have called her bad names because she wasn't self-actualizing. And why was she home taking care of a bunch of kids? So in essence, codependency is the tail end of feminism, the part of feminism that says to women, you shouldn't be there taking care of someone. You should be out taking care of you. As if taking care of others wasn't a choice or wasn't meaningful in and of itself. Codependence is a trauma-based theory of human relationships, which by definition says that if I partner with an addict, it's because there's something wrong with me. It says that I'm going to attach to another broken person because of my childhood issues, I'm always going to join with someone who's going to let me down and hurt me, and that repeats my childhood issues as I expect it to. And so my relationship with you, the addict, if I'm a caregiver, is just repeating my early childhood trauma-based experiences. I'm terrified of abandonment, and I'm just rescuing and taking care of you because I'm afraid you're going to leave, and I don't even see you at all. I just think that's all a bunch of crap. I really do, with all due respect. Now, the word codependency came from a word that Claudia Blackhead named in the 70s, which I really liked and I thought was great. And the idea was co-addiction. Because where codependency goes wrong, I absolutely certain of this, is it doesn't say, I'm obsessed and addicted with my husband's drinking problem. I can't get the drinking off my mind. I can't get him in the car driving drunk off my mind. That's co-addiction, where I feel just driven and focused on their problem. And I can buy that because if I have a friend who has cancer, I might buy every book on cancer and be obsessed with cancer because I want to help out my friend. I understand that. But to say that the reason that I am looking at and learning about and trying to help you with this is because there's something wrong with me, that just doesn't wash, and it doesn't help anybody. I don't attach. So here's the real deal. Fuck codependency. I don't stick by you as an addict because there's something wrong with me. I may stick by you as an addict because I learned how to stick by troubled people in my childhood, and so I know how to do it, but that's not pathology. I stick by you as an addict because I love you, and because I'm connected to you, and because you're important to me. And even when you let me down and hurt me, and even when there are years of drinking and using and misery, which the codependency people would say, what's wrong with you for staying with all that? I would say, because I love them. And I still see in them the parts that could be good and have been good. And I'm going to hold on to that because maybe they're going to get better. And why in the world would you take that person who is holding on to the light that has gone out in another person, hoping it will come back on? How could you call that person bad names and say there's anything wrong with them for holding out a light for us, for keeping the door open for us? Why would any of us turn on a partner and say there's something wrong with them? The only thing our partners and family members do is try to help us, try to stick by us, whether they're ragging or nagging or raging, or, most of our family members will say that in relationship to us and our problem, they became people they never wanted to be. They nag, they complain, they whine, they get jealous, they scream. They don't want to be that person. It's in relationship to someone they watch, who they love, who is failing, and they can't do anything about it. And it's making them crazy that this person they love is walking down the wrong path, and they cannot pull them back no matter how hard they try. That's the craziness of someone that you might call codependent. I would call them prodependent. That they're deeply invested in that other person for good reasons, because they love them. And they pray every night that that person's going to get sober, not because they want to re-engage some kind of trauma, but because they love them and they want their family back. And why would you pathologize someone whose goal is to reunite their family and have things go better? I don't get it. Melody Beattie said in 1986 in the book Codependent No More, she said, stop centering and focusing on other people. Settle down and in ourselves. Remember, she's speaking to women here. Stop seeking so much approval and validation from others. We don't need the approval of everyone and anyone. We only need our own approval. We have all the same sources for happiness and making choices inside of us that others do. So find and develop your own internal supply of peace, well-being, and self-esteem. Relationships help, but they cannot be our source. Well, let me tell you something. In therapy in the 1980s and 90s, our goals for people in therapy was for them to fully self-actualize, for them to be the best me that they could be out in the world. Talk about me generation. This was it. Every one of us was supposed to be singing our best songs out in the world and not focusing on others and not taking our own creativity and putting it out in the world and being amazing, creative. And, there was all that stuff in the air in the 70s. So what we forgot about, and what Melody Beattie certainly forgot about here, was that we are at our best, all of us human beings, when we're in connection to others. And I am better when I seek approval and I get it than when I don't seek approval. I am better when I am connected to others than when I am alone. And this concept, which makes sense for the 80s and makes no sense now, relationships help, but they cannot be our source. That's just not true. I've been married for 20 years and I have had the most success, the most happiness, the most stability since I've been married, because it allowed me to go out in the world and do my thing, knowing inside of me that there was a foundation and a rock waiting for me at home wherever I went. And that relationship is my source in addition to my faith. Family is what we all need. I say this to addicts all the time, and I'm going to say it to you guys today. I think it's such an important thing to say. As addicts, as an addict, I spent 35 years running away from home. I ran away. I ran to drugs. I ran to sex. I kept running away. Even when I could have put a home together, I ran away from the home I had. And I think in some ways, codependency with its independent kind of narcissistic vision doesn't push us home. It pushes us away. And I want to tell you that our goal as recovering addicts is to go home. The most important word in the language, H-O-M-E, home. When people are dying, where do they want to go? They want to go home. When we're in trouble, we want to go home. And what does that mean? It means we want to go back to the community of people where we feel loved and accepted and a part of, and we want to lean into them. And I would expect that I would want their approval and I would want their validation, and that my sources for happiness might be depleted, but they can prop me up and support me until I'm ready to give to others. And that we don't look at dependence as a bad thing anymore, as Melody Beatty did in 1986. Dependence is a good thing for men and women. What we want is interdependence. We're both separate and we're dependent, and we're separate. We are interdependent. What this message is, folks, is anti-dependent. And that's a problem. Okay. So what's wrong with this codependency model? First of all, from a therapy perspective, it asks for analysis. It asks for people to really self-examine. They have to go through their histories, their trauma histories, their past histories. And by the way, it tends to alienate them because they're all along there thinking, but I did everything I could to save this relationship. Why are you looking at me? I've seen partners come into a treatment center, bring that addict in, look at me with that, I got them here. They're finally going to be okay, and they're not going to be using. Now let's talk about how I get support as a partner. And they go into a room, and for 8 hours, they sit and tell them what's wrong with them because of codependency. And then I've seen those same people walk out the door of treatment and never come back because they refuse, thank goodness for them, to be told that this was their fault on any level. And addiction is not anyone's fault, but the addict's responsibility. You can fault anything you want as an addict, but it's still your responsibility whether you use or you don't. So, in fact, the whole idea of codependency kind of reinforces the idea that addicts maybe could use if their partner was too codependent. That's a bunch of crap, too. The model of codependency is a very early focus, very early, sometimes in the first session, on engaging partners and loved ones in a deep exploration of their trauma, their past, their part, their history, and helping them understand how their own issues and how they play them out are counterproductive to the healing of addiction. It really asks people we call codependent, which I don't believe in. It holds these people who've probably just been doing their best in an incredibly painful, difficult situation, and it's kind of turns them into enabling difficult people whose own problems have been making the addiction worse. What a nightmare. Gee, I'd really got to go to therapy to be told that I'm making the addiction worse. That would really motivate me to want to get better, because as a partner, I wouldn't feel it that way. I wouldn't see it that way. And I would want my therapist to understand that I've done the best I can to help this person, that I have pushed my life on the line to help this person because I love them. And there's nothing wrong with what I did, even if I didn't do it right. So don't come along and tell me that there's something wrong for my loving or the way that I loved, because I'm not going to take it. And I think this is why we have 400 books on codependency, because it doesn't work. Codependency attempts to devalue our human need to connect and remain connected and support each other no matter what. And that just doesn't fit with who we are as people. There's going to be a book number 500 on codependency because the model will never fully work as it's written. And that's why I'm here. I am tired of seeing partners and family members frustrated by being called names. I am tired of seeing parents who've done everything they could to keep a kid out of the gutter being told that they're enabling and rescuing their own frickin' child. And do you want to be the social worker or the therapist who says to a parent, you know, just let all the codependency go and let your child struggle, and then they wake up dead in the street 3 weeks later because you dealt with your codependency by letting them go? Who the hell would want to put their parent in that situation? So yes, I have strong feelings about this model that does not work and that leaves a lot of vulnerable people in a very vulnerable moment forced to blame themselves for part of the problem. So here's what we do in addiction treatment with you addicts. In 15 seconds, I'm going to give you the bottom line of what we do. We explore your problem. We figure out the whole thing. Alcohol, drugs, in our sex addiction program, in Seeking Integrity, which is our sex addiction program, and our sex and drug addiction program. This is what we're doing. I'm figuring out what the heck you did out there. I'm confronting the ways that you drank or used or sex that made it okay for you. I'm confronting the way you think that made you do something that you know wasn't okay. Now I'm clearly defining how you got to the problem, what the problem is. I'm helping you find a way to stop doing it. I'm challenging all the ways it hurt your life. I'm building peer support to help you stop. And then we do the whole thing over and over and over again. Every meeting you go to, you're doing this as an addict. But is this what partners need and family members? Because that's what codependency says. It puts them in the same, well, it says they're addicts. They're addicted to their loved one, right? They're addicted to their loved one. And so they too need to work an addiction program by exploring their problem with love, confronting the ways that their love has gone wrong, clearly defining the way their love has been problematic and that they shouldn't give so much. Then we have to put a container around them so they don't do and give and care so much. And then we have to challenge and confront all their feelings about how much they want to rescue and save the person they love. And then we have to build a lot of support for their detachment and distancing from the troubled person. I don't think that that's what partners need. I don't think that partners and family members have a behavioral problem. I think they are reacting to a crisis that is not of their own making, that they can't fix in someone they love. Does the addiction model serve families and loved ones? Not really, not in this way. It does socially, but it doesn't necessarily in terms of behavior change. And that's the core of the problem with codependency. Because you see, and I really want you guys to hear this, write this down, sing it to the hills, and buy the book. I make 15 cents when you buy a book, but spread the word. Being obsessed with saving a loved one is not an addiction. It's healthy. If I love someone and they're failing and I spend a year of my life trying to get them well and they get well, I am a hero. I'm a double hero because I gave up a year of my life to make this happen. I'm not a double crazy person. I'm not a double over-dependent loser. I'm someone who had enough love and faith to believe in someone to help them get well. Now, there are people who are delusional and get involved with people who will never get well, and they need to move off that dime. There are other people who absolutely, are involved in pathological and problematic relationships, but there is no reason to say ever that everyone who gets in a relationship with an addict or another troubled person knew that that was going to happen, had it in their history that it was going to play out there, and that nor should we ever say that their attempts to save the person they love and anything they do in trying to save them is wrong. I'm going to give you an example of this from the alcohol world. And I know some of you are going to just shake your heads and go, oh my God, he doesn't get it. And for you, I will say, hey, we don't have to be in agreement. But this is how strongly I feel about this issue. I worked with a woman, true, whose husband would drink all day and night. And the problem was they had 2 kids, he needed to work. And so he would go to work drunk and he would get fired. He would pick up the kids drunk and they would call the security because this man shouldn't be driving drunk with his kids. This poor woman had 4 kids and a husband who couldn't work, got DUIs, and was driving home with the kids drunk. And she had no idea how to help his alcoholism. After all, it's not like everyone who was an alcoholic partner went to get a KDAC She doesn't know how to fix his alcoholism. She just knows whatever she can do to make her life better. So she makes a decision, my AA friends, and especially my Al-Anon friends. She says, you know what? She says to her husband, look, here's a crisp, cold bottle of vodka, and I'm putting it on the dining room table, and it's 4 o'clock. And you know what? If you can not drink in the morning and get through your workday, if you can pick up my kids and not be drunk when you pick them up and not get arrested for a DUI, when you get home at 4 o'clock, you can drink as much as you want. Can you imagine what would be said about that woman bringing bottles home to her alcoholic husband and a codependency model? You know what I call her behavior? Harm reduction. Even though she didn't know how to make it better to fix her husband, she did figure out how to get 2 more good years out of that man, to get money in the house and have him not arrested and have those kids in school. Now, eventually, he started drinking during the day again because he wasn't able to maintain that agreement, and that's when she came to see me. But don't ever tell me that her ability to get him to not drink in the daytime for 2 years is enabling. She did the best she could to help her family, and I say good on her. I would cheer for her. But I have a feeling if she went to a CODA meeting, they would rip her to shreds. And that scares me and makes me sad for where we are in this process as a group. Obsession with saving and loving, obsession with, one more time, your obsession with saving a loved health one isn't an addiction, it's healthy. Now, you may not be able to help them, and the way you go about trying to help them may be horrible and obsessive and problematic, but your desire to have that person be well so you can rejoin with them is as healthy gets. Okay, so let's see. I'm going to pick some, I'm moving past some of the therapy stuff to just talk to you more about. So, I mean, things like charts and graphs and things I talk to therapists about. So what I'm offering you, and I wrote a book about this called Prodependence. And I have to tell you, it's a book that every partner I've talked to loves, because this is the first time that, I'll just say this, I've had so many people cry. I've had people come up on a book line with 5 copies of this book and say to me, you changed my life. I blame myself for so long over what's happened. You finally told me I don't have to blame myself anymore. You know, I've had people say, I'm going to give this to every friend I know who's lost an addict so they can forgive themselves. I don't know how we managed to visit this concept onto people who love addicts that leaves them feeling so awful about what they gave and what they did, but I want it to go away. So I wrote a model called Prodependence, and I flipped codependency on its ear. And I said that anything and everything that a partner does or a family member with the goal of getting their loved one well, whether it works or it doesn't, is done from love. And I will never challenge or confront that person for putting that bottle on the table at 4 o'clock, because she loved her husband and she loved her family, and that was the best she could do. Now she's brought me in, and maybe we can get him off the alcohol altogether, but what she did was save her family for 2 years. So when the spouse or a loved one of an active addict comes into my office, someone you would have called codependent, I see them as a person who is in the middle of a profound life crisis, the failing of someone or one's people they love. And this crisis is not of their own making. They didn't turn that person into an addict. And it's one that anybody would have real difficulty solving. They don't know how to fix it on their own. And it's very shameful. By definition, if you're involved with someone and their life falls apart and you're walking around with the pieces all around you, you are a victim of that person's behavior. Partners and family members are victimized and betrayed by the active addict. I don't know why that word, don't be a victim, bothers people so much. If I marry you and I love you and we have a great relationship, and all of a sudden you get involved with heroin and you start stealing my jewelry and running away with my car and sleeping with other people, I've been victimized, clearly. You turned it to someone else and you hurt me. I don't understand why we can't call it what it is. Partners of addicts are victimized. Parents of addicts are victimized by the addiction. By definition, they've been betrayed by the active addict because this is someone that they often have a close bond with, and yet this person is lying and manipulating and seducing and stealing and doing whatever they can to keep their addiction going. We don't break our trust as addicts with our partners because we use. We do not break our trust with our addict. We don't break as addicts our trust with our partners and friends because we sex or gamble. It's because we lie. It is the manipulation and the lying that destroys the bond we have with our partners. That is what is abusive to them. We break their hearts and we break their souls and we break our relationships, not so much by our addictive behavior, but by the lying and the manipulation and the seduction and the gaslighting that we employ to keep using without them getting in our way. By the way, if you asked me how I do think of a partner of an addict or a parent, I would say that they're in a crisis. I would say that when you love someone and they have failed themselves by alcohol, drugs, whatever's going on, cutting on themselves, that you're in a crisis because you love this person and you're afraid of losing them. You've seen them grow and now fall apart. You're completely in a crisis and you can't make it better and you're losing them day by day. That's terrifying. And I wouldn't call that codependency. Whatever you're trying to do, you can't make it better. I would say you're in a crisis. And in my mind, people in a crisis need crisis counseling, not to be told that they're codependent. They don't need analysis or exploration or evaluations or interventions. They need support. If you're a partner of an addict and you've been living with addiction or have just been coming off living with addiction, you need love, you need care, you need validation. You need everybody to tell you that you did your best. And the last thing you need is anybody to walk up to you with a pad of paper and say, let's look at how your mom and dad raised you and how that relates to your marrying this addict. To that I say, fuck you. I don't want to talk about that. I want to talk about how I'm going to get through the day. And is this person I love going to get better? I can worry about that later. So I say to my peers, to therapists who are so in bed with codependency, and I can't imagine why, I say, let's stop romanticizing these concepts and paradigms that don't work. And let's move on to something that does. So here's a little insight into what therapists think about partners. What if the loved ones of addicts aren't so difficult to treat because we think you are? What if the problem in treating you guys lies more in how we have thought about you and the box we've put you in, rather than you're actually being difficult? What if the primary therapy model that we've had for 35 years for treating spouses and family members of addicts has left them feeling more misunderstood and marginalized and confused and blamed and shamed, rather than invited into healing? Why would you ever prejudge a loved one as an addict, as codependent, or anything? Why would you want to encourage someone who's done their best to help you as being the driver or even a participant in a dysfunctional family system? They just love you and want you to get better, and they're doing everything they can. And even if it looks like their past trauma, who cares? It comes out of love. They're trying to heal us. I don't see how you can blame them or pathologize them for that. Why don't we focus on our partner and parents' strengths? Why don't we give these family members who have stuck by us, who've stuck by the problem, validation and kudos for their strength of character and willingness to stand through this much pain, instead of blaming them for hanging out with us and watching us go down? And why would you do that? It doesn't hurt you. Why don't we celebrate them for being willing to stick by us no matter how much it hurt them? Why can't we focus on their strengths? And why must we focus on the trauma of a partner's past when they have plenty of trauma in their present? I get that therapists see trauma in everybody. That's what we do. And you're going to certainly see a lot of trauma and trauma reactivity in the partner or parent of an addict. But you know what? Why don't you just put that on a piece of paper and put it away? Because there's plenty of trauma to go around and work on here and now if somebody's involved with an active addict. Why don't we give partners and family members who are coming from love, no matter how angry they are, the grace to come to us if they want to look at their past or self-examine or self-explore? I think to do so is sort of abusive. Really, I think most of them come to us simply because they want things to be better, back the way they were when they were good. I don't know that everyone comes to us wanting to be enlightened and grow, and I don't think that's necessarily our goal, but we sure try to spend 3 years developing people sometimes who are just trying to get through a problem of an alcoholic partner. I think we can help you partners and you family members and you people who love addicts without lengthy explorations of your often painful past. It's just none of our business. So one of the underlying things that's changed since Melody Beatty and Claudia Black and all those people were writing in the 80s was how our underlying beliefs about how we look at mental health have shifted significantly since the 1980s. As I said earlier, the goal of treatment in the 1980s was self-actualization. Every part of you, your voice, your body, your ears, your nose, every part of you fully invested in the world, fully present all the time, with none of the stuff from your past in the way. That was sort of, be the best you can be, was really what the 80s, 70s and 80s were about, unless you were very, very mentally ill. And so, as I said, this move of women to move away from men and dependency and be the best them, they could be alone. But I'm not sure women or any of us that really are at our best alone. I think we're actually at our best in relationship with others, leaning into others, depending on others. That's actually when we're at our best. So here's the deal. Our focus, you may not know this, but I know this. The focus on healing in mental health and addiction since the 1980s has turned away from self-actualization, me being the best me I can be, as a measure of health and success, to today, where my health and success is viewed not only in terms of that, but also is viewed in terms of the strengths of my relationships and attachments. Today, I am as strong as my connections to my sponsor, to my friends, to my therapist, how connected I am, how I've created home and family with the people around me. That's my strength. I don't have to be the best me I can be, but I can grow to be a better family member, a better partner in the workplace, and a better part of my community. And all of that will make me happier. I truly believe that despite some of you folks and how you feel about us boomers, the me generation has moved on. It moved on probably in the late 1980s, and we moved more toward connection as a view of mental health. And I really think it's time for all of our counseling methods to move away from pathology like codependency and move more towards strength and health. I know I just have a minute or two, but I want to say a couple of things. The words of codependency I find to be abusive. And I don't see why these words have to be made negative. So I took all the standard words that I hear in codependency talk all the time, and I said, is there a positive way to look at these things in terms of this person isn't doing this because they're sick, they're doing it because they're well. And this is what I got. When someone's sick, they're really enmeshed with that other person. But when they're well, what's really going on is they're deeply involved. So instead of saying they're enmeshed, why don't we say they're deeply involved? Instead of saying they're focused on everything but the problem, which is them, why don't we say that they're deeply focused on the problem itself, which is the addict? That is the problem. Their life would be a lot better if that person wasn't drinking and using. Instead of saying they're enabling, why don't we say that they're doing their best as they know how to support the person they love? Instead of calling them codependent and filled with fear, why don't we say they're deeply concerned about the outcome of some very obvious problems? Instead of saying they have no boundaries, why don't we say that they are so eager to jump in there and care for the person they love? Instead of saying that the codependent partner can't stop fixing, why don't we say that they are determined to do whatever they can for the health and love of their family? Instead of saying that a codependent partner is in denial, why don't we say that they're actually unwilling to give up on someone they love despite all the things that are going on? It's actually a choice. Instead of saying that these people are controlling and nagging and all of that horrible stuff, why don't we say that they're doing everything they can to try to effect change, to make things different? And no matter how hard they try, things aren't changing. And so they get more like they don't want to be because they're trying so hard to effect change and it's not happening. And we say, oh my God, they're so hypervigilant. They're scared of everything. Of course they are. They've had a lot of problems in this relationship. There's been a lot of problems living with that alcoholic when the doorbell rings and the police are there. I am anticipating as the partner of an addict that there's going to be more problems because I've had lots. And that's not pathology. That's just knowing what I've been through and expecting to continue. So I'm almost done. In addiction recovery, the most effective way for us addicts to overcome addiction is to develop healthy, meaningful, ongoing connections with sponsors, with people in meetings, with therapists, with loved ones. Unquestionably, the most important of our connections are the people we love the most, our pro-dependent loved ones, the ones who stuck by us for good reasons. They stuck by us for good reasons. This codependent fear that caregiving loved ones might behave in ways that enable or perpetuate the addiction, I guess that's possible, but the solution is not to detach. The solution is to stay connected and to continue caregiving, but in more effective ways. You know, bringing home that bottle at 4, that was a really good idea then, but now I think we need to find a different way to do it. Notice how I didn't say, well, you know, if your mother hadn't bringing bottles home from your dad and you haven't watched, then you wouldn't have learned. Who cares? I just said, wow, that was a really effective way to get him to not drink in the morning and the afternoon. That was really clever, but over time it isn't working. Let's find something else that might work all day long. And that's us working to take the alcoholic or the drug addict to the next step, further than they were able to take them by themselves. I say love that addict and love them absolutely, but love them more effectively. Learn how to manage the situations as they come up rather than just reacting to them. Okay, let me see. This is therapy stuff. So I may just be stopping in a minute. I think I have one more little slide, Tammy. 2. So these are just a couple of things. There are things that codependency absolutely got right, and that is that partners and family members do need to take a significant amount of their time and attention and put it on themselves. If they're going, but I'll say it differently, not to get away from the addict, but in order to keep supporting and caregiving for the addict and for themselves, they need to do a lot of self-care, boundaries, how to assert anger, how to get their own help, how to educate themselves about addiction. I mean, they need a lot of help and support because they're going through a very difficult time in the stress of living with this addict. They need a lot of support to survive that. You know, we have cancer survivor groups for partners who are living with someone with cancer and how horrible it is to love someone who has cancer. There's nothing wrong with someone entering a group to be supported for the challenges they have living with an addict, but not for what's wrong with them for living with an addict. That's where I draw the line, as does Prodependence. I don't want to give these people any reason. You love me and I'm an addict and you've done the best to love me you can. I'm not going to give you any reason to doubt yourself. I'm not going to ask you to examine your past. I'm going to ask you to be right here and right now with me. And we will have the same goals of my healing my addiction and you growing yourself while continuing to love me and I love you. But we're going to see the problem through a very different lens. We're not going to see you as broken and desperate and acting out your trauma. We're going to see you as brave and courageous and so filled with love that you're willing to stand by us no matter what. And boy, do I love this model. My final slide. When did love become pathology? Meaning, when did love become a bad thing? You cannot love too much. You just can't. And if you love too much, I hope you're someone like my friend Tammy, who will make me a cake at Thanksgiving. I want everybody around who loves me too much. We're going to have a great time loving each other. Now, addicts, know this. You can love inadequately. You can love where you're not getting any love back. You can love in ways where you're not getting anything from it. You can love the wrong person. You can love in ways that do mirror your past trauma. You can love in ways that cause more harm than good, whether you mean it or not. And you can certainly end up loving someone who doesn't love you back. But don't ever tell me that you can love too much. And don't ever tell me that caring for a troubled person that you deeply love could be anything, come from anything else but the love that you have. And that's Prodependence. Thank you.
So we have some questions. The first one is, how do we as addicts draw the line since we have very weak boundaries? I feel that as a woman, I totally do care too much and it affects me in relationships, career, and everything else. I am not masculine, but as you had mentioned, this is not mentioned in society.
Get help.
Thoughts
I mean, if I have trouble with something and there are many things as an addict that are not my skill set. And, I can't tell you. So Tammy and I work together at Seeking Integrity. And by the way, we do the Rob and Tammy show on Monday nights at Sex and Relationship Healing. If you want to hang out with the two of us, we're answering questions on Mondays. But anyway, I often go to Tammy and ask like some kind of like, I have no idea what to do, kind of questions. I don't ever stop trying to figure things out. And listen, this is true for partners as well as addicts. Our own best thinking got us here, meaning I did everything I could to help them. I tried, not like an addict, like your own best thinking got you to be a drunk. That's a different kind of statement. For you guys, it's more like I did everything I could and I tried everything I can, and now I'm just exhausted and the problem isn't getting better. Okay, then let's get you some help with people who can support you and know a little bit more about how to get this problem to heal. By yourself, you may not be able to set and maintain boundaries, but by having this active support of others. I mean active, like you call them after you talk to your husband and you say, I just said this to him, or before you call, I'm going to say these things, like really holding yourself accountable, or doing this discussion in front of a therapist where you have someone to witness it. Get the help you need to say and do the things you need to do. Putting the pressure on yourself to be able to figure it out if you don't know how, I'm not sure that that's the right way to go. Really quickly, to 120 of you, I am here in this room every Friday night at 6 o'clock answering questions about sex, love, and addiction. And if you've always thought, I want to go to a therapist and talk about this and ask questions, but I just can't afford it, or I don't want to go to those S meetings, you can come on Friday night and anonymously ask questions about sex, love, and addiction. Or you can write me at rob@seekingintegrity.com. I am rob@seekingintegrity.com. Seeking Integrity is the name of our treatment center. And if you're looking for a therapist or direction or information, Tammy and I do not get kickbacks. We will just refer you after 25 years of the field, or 50 between us, to the people that we know are really excellent. So, Tammy, more questions?
No, I think we mostly covered them. So
okay.
Join Dr. Rob on Friday night here. Join Dr. Rob on Monday night on sexandrelationshiphealing.com.
And there's a podcast.
We
have over 500,000 downloads to sex, love, and addiction, with a lot of famous, amazing therapists from all over the world. And if you want to look at relationship challenges or love challenges, stop by the podcast.
And the next Super Saturday Recovery Summit, October 17th.
Can I speak again? I want to go every time.
We'll talk.
Okay. Thanks, you guys.
Thanks, everybody.
Thank you, Tammy. And thanks to In the Rooms. You guys are wonderful. And we are so grateful, all of us, to have a platform where we can connect like this toward healing. Thank you so much to the In the Rooms folks. And we'll see you guys soon. Bye for now.